Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His New York Times best-selling book is titled Lies I Taught in Medical School. And now, please enjoy this week's episode as we explore the secrets of Ozempic and other GLP-1 agonists with Dr. Amer Sayed.
This week, we get to learn all about the GLP-1 agonists that everyone's talking about and how they're revolutionizing weight loss and health management. We sit down with Dr. Amer Sayed, a cardiologist and an inspiring figure who has faced his own battles with obesity. Inspired by a peptide found in lizards, these medications offer new hope for individuals struggling with weight despite leading active lifestyles. Amir's firsthand experience and professional insights reveal how these game-changing drugs can help suppress appetite, reduce gastrointestinal motility, and lead to significant improvements in blood pressure and diabetes management. We then unravel the specifics of semaglutide and terzapatide, two prominent GLP-1 agonists, addressing critical questions about who might benefit from these medications and who should avoid them. From potential side effects like nausea and headaches to serious considerations for those with thyroid cancer or pancreatitis, we leave no stone unturned. Amir sheds light on how to manage these side effects and underscores the importance of diligent monitoring and open communication with healthcare providers to ensure patient safety. Join us for an episode filled with invaluable insights and real-life success stories that could inspire your own path to wellness. This episode is sponsored by Syed Health. One of the most common questions I get asked is which blood tests I check myself on a regular basis. Well, I check 17 biomarkers, but the secret is I'm able to do everything from the convenience of my home. I collect a sample with just a simple finger stick like this. You don't need to be a doctor to do it. Then I just mail it in and wait for the results. Syed Health makes it possible. Use the link below to get 15% off. This episode is brought to you by L-Nutra, maker of the Prolong Fasting Mimicking Diet. If you'd like to try it, use the link in the show notes for 20% off. And now, please enjoy this week's episode. Hey, Amir, welcome to the program.
Thank you. Thank you for having me.
This is going to be so much fun to talk about GLP-1 agonists. They're in all the news. Everybody's on everybody's mind, and the overriding problem of obesity, where now most adults are either overweight or frankly obese. But before we dive into that, maybe just tell us a little bit about your background and how you came to be interested in this fascinating area.
Yeah, so I'm a cardiologist by training. I took my last board in structural cardiology, actually, from Yale University in Connecticut, New Haven. And I've been struggling with obesity for more than 10 years now, even though I'm very active. I play basketball, I go to the gym every day. It's just struggling with extra bites here and there that make my weight is on the higher side. So my BMI was on the 31 range, and I have been trying to lose weight for a while. Being a cardiologist and knowing the obesity and everything that comes with it, the metabolic syndrome and hypertension, diabetes, hypercholesterol, and I'm treating that on a daily basis. So when I heard about the GLP-1, I studied it more, and I saw a lot of people having great results on it. And when they approved it for purely weight loss almost a year ago, I was interested in using it myself. Unfortunately, I didn't have diabetes, so my insurance did not approve me. So I bought it myself, and I lost maybe the first month around 10 pounds. And I was very, very interested in it. So I started prescribing it to my patients, and not surprisingly, but I can see it very quickly that patients are getting off blood pressure medications, cholesterol numbers getting better, and even A1C numbers getting better, and patients are breathing better. They're not using their CPAP anymore. So there's a lot of benefit I found from just losing weight with those medications, and I felt, I'm not gonna leave this to anybody else. I'm gonna do it myself, because there's a lot of doctors have hesitance of prescribing it. They don't know much about it. They don't want to deal with it. I don't know what the exact reason that's not all the doctors able to prescribe it, and I feel comfortable doing it. So I felt, let me do that, and I saw great results with my patients, and then it started to be my standard practice to check about on their weight, all my patients, and try to decrease the BMI to the normal level as possible.
Mm-hmm. Yeah, well, this is such an important area, for all the reasons we've mentioned. Now, let's back up and what is GLP-1? Let's start with the basics and assume people don't know anything.
Yeah, I mean, yeah, it's interesting way to use it, and I think I dived more into like how did they start finding like the original of this medication, and it came from actually the idea from lizards, like actual lizards. They have high amount of GLP-1 in their blood. It's natural hormone or peptide in the body, natural hormone that decrease the GI motility, and I think the researcher just try to increase it and reproduce it and inject it in animal mode, and then after that, and to make it like diabetes medication. They found the effect of decrease in appetite by decreasing the GI motility and other ways of action. And that's how you lose weight. Basically, you decrease the GI motility and you feel full most of the time when you take the injection once a week.
And so this GLP-1 is like you say, it's a molecule or peptide, I guess a glucagon-like peptide.
Peptide, yeah.
And it's naturally occurring, right? And glucagon, as we learned in medical school, is, it's like the counterpart to insulin, sort of, in sort of a way of dealing with the way the body processes nutrients and senses nutrients and things. So and then it has this effect on diet, right? I mean, excuse me, effect on appetite, so that people lose their appetite. Is that the main effect, you think, that the weight loss is mediated through that?
Correct. I think that's the main effect, and the main side effects that may happen from the GLP-1 agonist is that it slows down the GI motility, and that's why you feel you are full most of the time when you are on it. And the side effect comes from the nausea. You feel nauseated when you eat, or feel like uncomfortable when you eat a big meal, and also constipation is the main side effect of those medication, but it's also the effect. And luckily, those side effects are very mild and just mostly when you start using the medications. That's why we started in lower dose and ask the patient to increase their salad and fibers in their diet to decrease those kind of side effects. And in very rare occasion, we give Zofran for those patients, but it's not the mainstream of treatment. But overall, it does decrease the GI effect, and it has some central effect on the appetite center in the brain, just indirectly. But the main effect is, as you said, the counterpart of the insulin, and it works in decreasing the motility of the GI system.
So that's the main effect. So it's this GLP-1 agonist, and an agonist, of course, is it's the opposite of an antagonist. So it's similar to it. So it's similar to GLP-1 glucagon-like peptide one molecule. So it acts similar to those, and that's how that got the long convoluted name. And,
Correct.
and everything with that. And so you mentioned the dosage. It's not a pill, right? So it's not a pill, but it's something that's injected. And how often do we need to do that when patients have
So
that?
usually it's once a week. That's a recommendation, and that's what the studies recommended and used. So it's a weekly injection, usually either in the thigh or the belly, beside the belly button, or in the arm. Everybody's different. I use it myself in the belly; it's just easier for me. And it's once a week. And newly they have this sublingual or oral one. It's not very full studies as the injections, but some people are afraid of needles, and they made this daily semaglutide pill, or sublingual kind of drops they call them. But they're not well studied, and I don't usually deal with them very much. But the injections once a week, and you take it as the doctor recommended, and obviously you have to accommodate that with certain diet. And the reason for the diet, you will lose weight with diet or without diet because you're not going to have appetite. But the diet is to make sure you're not losing from your muscle mass. So, as a doctor, you don't want, we care about cosmetic weight loss, but what I really interested in, and losing weight in a healthy way and keep it off. So that's why we accommodate some kind of exercise programs and certain diet, high protein diet, high fiber diet, low carbs, and low fatty diet. So the body or the person will adjust to a healthy diet. So when we wean them off the medication, they can keep the weight off. And that's the whole purpose. Those medications are not forever. And I know some patients asks me, like, you always think about the easy solution for a problem. This is a help, and it's an excellent help. Luckily, humanity have, I would say, in the last year, and I think it will cause a great change in the pyramid of the weight loss. But we have to do it the right way by making the effort on changing the diet habit and doing exercise in the right way, so we lose weight and keep it off.
And so the treatment, as you said, is an injection once a week, and the patient does that themselves. They don't need to go into an office for that. And how long does it continue? You said it was for a limited period. And what are your end marks or
Yeah,
guidelines for that?
it's a good question. There's no certain guidelines. However, the weight loss in average is between 6 pounds to 10 pounds on average. Some people less, some people more. We try not to make it more than 10 to 12 pounds overall. And it depends on how much you start with. If you start with 400 pounds, different than starting with 220 pounds. So we try to lose in like certain percentage. However, we look at the target weight. So if you want to lose 30, 40 pounds, probably 3, 4 months injections, and try to wean it off as possible in a month or so. And obviously, with the right diet, with the right exercise, and decreasing the dosage of the medication gradually, the weight will stay off. The stomach will become a little smaller. The patient will enjoy, being an optimal weight, and they will stay motivated. Most of the time, I let the patients see nutritionists, dietitianists, trainers, mostly online or in person, depends on their comfort level. And So far, success rate is more than 90%, which is excellent in medical field to have any approach to have 90% or more success rate.
Yeah, yeah, that's a great effect. What who can take this? Like, what are the contraindications for it? Is it all ages, or is it just adults? And who?
So yeah, usually prefer to be 18 years old to 70 years old, even though, with the right people, age is just a number. It can be case to case based. It's approved to 12 to 18 years old, probably the semaglutide, which is less potent than the terzapatide, which is the Manjaro. The semaglutide is the Ozempic Wegovy. I'm going to talk about the active ingredient now. So the semaglutide is working on GLP-1 one receptors, but the terzapatide works on two. So it's still more potent. So that's why 12 years old to 18 years old, we try to use the less potent one. However, the doctor can decide. Now, the contraindications, try to avoid it in pregnancy and even breastfeeding, just because, from the effect of it, it can cause nausea, and pregnancy, it has nausea. You don't want intractable nausea or vomiting for those patients, and, dehydration and all those things. You don't want that to happen during the pregnancy or breastfeeding. Usually thyroid cancer, medullary thyroid cancer, even either with the patient or a first degree relative, we try to avoid it because they found some association with the increased risk of thyroid cancer. That's why it's part of my initial intake. If you have thyroid cancer, it's not probably the right medication for you unless you see your endocrinologist and try to approve it. Even with that, I don't think I feel comfortable, just because the studies showed increased risk. Pancreatitis is history of pancreatitis, also probably relative contraindication, just because it acts on the insulin and contra insulin and all those things. You try to avoid that. Severe constipation, you don't want to exacerbate that. The other things to consider with GLP-1 is if you have like near future surgeries, and with all the anesthesia that you may have that decrease the GI motility, you don't want to increase that. So we usually stop it a couple of weeks prior and resume it maybe after, just to increase safety. Actually, anesthesia nowadays, they cancel the elective surgeries if you are on GLP-1 agonist medications. That's very much it. And you don't want to mix. It's eventually it's a diabetic medication. You don't want to be on high dose insulin and multiple other oral medication for diabetes. So that should be very monitored very well with your physician.
Yeah, so the GI symptoms, mainly based on the motility that we talked about as one of the primary mechanisms. Are there any other symptoms, if I'm taking it, that I should be on alert for?
Really, from experience and from the studies, a headache can be a problem, and mainly from dehydration. From a personal experience and from the patients I have, increasing your oral intake, your fluid oral intake, and electrolytes, Gatorade, vitamin waters, like electrolyte hydration, decrease that. Depression can be a problem. So if you have untreated depression, probably this is not the right medication for you. Again, if you have treated stable conditions of hypothyroidism, not talking about cancer, hypothyroidism, pH is stable, it's okay. If you have depression that's controlled in your medications, I pay close attention to them. I may not escalate the dosage, like those medication, you escalate dosage by the studies every 2 weeks, 4 weeks, monthly. So you try to maybe do it less and start low, and you just increase it slowly just to avoid. But usually the headache and the depression are the main big things that you may see.
Hmm. And just skipping back to the cancer, it's only thyroid cancer. It's not a risk with other types of cancers, right?
That's from the studies. Now, if you have actual active cancer, I try to avoid it just because the potential need for chemotherapy or other things, especially if the weight is not terribly high, because depression can be caused, dehydration, all those things. So active cancer, we take a case by case, leukemia, all those things. But if it's a treated cancer, if it's slow growing cancer that we already talked with hematology oncology, we don't think the prognosis is okay, there's no potential chemo needed. We still give it under close monitoring. But the medication and the association between this medication and possible causative effect is medullary cancer on the thyroid.
Yeah, and the depression issue you raised, I know there have been some studies about suicide rates. I assume that's
Correct.
related to depression then,
Correct.
with this. I wonder what the mechanism is for that. I mean, I
You
guess we don't
know,
really.
I from personal experience, and that's not really the mainstream. Some people, and a lot of people, they feel joy in eating. You're decreasing that, and some people calls me and it's like, okay, I lost a few pounds and everything for a couple of weeks, I don't want to take it anymore, and the reason for that is like, I like to eat and I'm fine. I'm gonna, I don't want to not eat. So that's a personal choice, and uh, but there is a joy in eating, and what we are trying to do is not to take that off. We just decrease the weight in a healthy way, and then you can eat your normal calorie intake, whatever you spend. You want to eat a little more, exercise a little more. But those medications, I still encourage people to take care of their weight in a healthy way. But if they can't, this medication will be able to decrease, because if you are 300 pounds, it's very hard for you to run, to exercise, with all the depression that may come with it, with the breathing problem, with other, the medication you may be on. So those medications can help you for 3 months, 6 months. You don't have to be an optimal weight to get off them. Just get the large amount of weight off with 3 months, even with the little side effect that may have, and then take it over. That's my suggestions usually to my patients.
Yeah, and one of the amazing things about these drugs is the effect on other chronic diseases that we're seeing. You mentioned a few of them downstream, and it speaks to, sort of the underlying metabolic root cause of any of these diseases. And this drug, through its actions, is affecting, metabolic health at a basic level, which amplifies across to, potentially cardiovascular disease, the whole stream, cancer, Alzheimer's, all the way down the road. Do you think the effect is the metabolic health benefit is primarily mediated through weight loss, or is it something more fundamental? In other words, if a thin person takes this, will they still see the metabolically, not a thin, but a kind of average weight person takes
Yeah.
this, would they still see the metabolic benefits without necessarily the weight loss? You know what I mean?
Yeah, yeah. I mean, for those things, it's hard to have an opinion on it. It has to
Yeah.
have a randomized controlled trial to know what we're saying. Like, my opinion doesn't mean much, to be honest, because we have a lot of opinion. Like, you remember the aspirin. Everybody should be on aspirin to decrease heart attacks. Remember that.
Yeah.
Then they had to do a randomized controlled trial and spends tens of millions of dollars, and we saw that no, it does not decrease heart attacks for healthy people, and you should not be on it automatically. That's against the normal, what doctor would have said in the past. The same thing as beta blocker. It used to be contraindicated for heart failure. Now, if you have heart failure, you have to give beta blocker, otherwise you will do malpractice to your patient. So, and the same thing with statin. We thought statin decreased the heart problems with just decreasing the cholesterol level. However, we saw independent kind of antioxidant effect of statin on the overall health and decreasing all kind of risks and mortalities. So to answer this question, I don't know, but I will not be surprised if after 2-3 years we see an independent effect of those medication on health overall. But what I know for sure that decrease in diabetes, improving diabetes and hypertension and cholesterol, decrease in that will make you live better and will make you live longer.
Yeah, yeah. Well, let's talk about your company now. You're obviously excited about this peptide and want to make it available to more people. So, tell us what you're doing with that and how people can access it.
Yeah, me and my partner, we are very excited about the same, like weight loss and all those things. So we decided to do tenuous.com, tenuiss.com. It's an online website. It's a platform. It has doctors, has dietitian, has life coaches, trainers, and all those. We have a complete weight loss clinic that we also send the actual medications, the terzapatide and semaglutide, to the patient's door from just online video encounter usually. And we are in 22 states now, and we just wanted to make this medication and treatment available to the patients in the right way. Like not just dispensing medication and good luck. We follow with them. We make sure they are losing weight in a healthy way, and we are just a click away nowadays for weight loss. They can schedule appointment with us. We talk like what we're talking right now, see if they are the right medication. If it is, it takes few days. The medication will be on the doorsteps, and they start injecting, and we follow up with them sometimes weekly, sometimes bi-weekly, monthly, depends on the response. And we're available to them. We have a lot of doctors involved in this, and the dietitians and the life coach, to make it more a team approach for weight loss. And I'm very pleased with the results we're having with the patients and the satisfaction that I have. It's really very promising, and we're gonna keep doing that.
Yeah, and we didn't say at the beginning, but we should have. These drugs are prescription only, so you need to work with a physician to get these, and it's important that you work with a physician who has experience and knowledge in dealing specifically with these drugs. And your group obviously has that. That's great. So they basically just call you over Zoom. They can have the conversation and speak with your whole team and get it taken care of there. And most states in the United States are 19, about half, I guess, it's available.
Yeah.
They can check on your website and see what those are. What are the if people stop using it, what are the main reasons in your experience? Or is that not a problem?
It is a problem. That's why I don't say success rate is 100%. The success rate is 90 to 95%. Some people do not have appetite suppression. They're luckily very, very rare. But there is, if you deal with thousands of patients, you will have few that is like, I like took nothing. I have one of actually friend, not a patient. He reached the Manjaro of 15, and it's like literally took not like nothing. For me, I take 2.5, which is the lower dose, and my appetite is suppressed for a week. So he's taken. So it's just people are different. That's why there's other ways to lose weight beside the GLP-1. We also use it. We don't just use the GLP-1 and tenuous.com. We have other options. So that's one reason. The other reason is depression. If they have underlying depression or they don't know they had depression and you start them, they don't feel good. And luckily, it's also rare. Other reasons for that, finance, if they don't have a couple of $100 a month, they cannot. And those medications are, they are, on the cheapest side, because especially for tenuous.com, we use the brand name and we use the compound. Compound is FDA approved, some pharmacies to compound the same active ingredient, and it is lower price. So for us, like the semaglutide is $179 a month, the terzapatide is $299 a month. It's still significant amount of money. If you don't have the means, it will be a reason to stop. Those are basically the main 2-3 reasons.
And can patients pay for this with their insurance now, or is it cash basis, and how does that work?
So my company use only cash. However, insurance company does pay, but they have a lot of, let's say, criteria that a lot of people don't meet if they only have obesity. Most of the time, you should have diabetes with the obesity to approve it, and not all. You should have a really good insurance and good employer, because it's not only the insurance. The employer sometimes give you good insurance and tell the insurance, the employer tells the insurance, we're not going to pay for weight loss period, because it costs almost 1,100 a month for the brand name. So some employers, like, we don't want to deal with that. But cash pay, that's why we're dealing with the compound heavily, because we want this treatment to be available, and it's the same active ingredient as the brand name. And that's what I personally use, to be honest. I used to pay, I have I used to have pre-diabetes with BMI of 31. Like, I'm the perfect, my A1C was 5.9, and my insurance did decline me. I don't know if it was my employer and I'm a physician, cardiologist, so I assumed I had a good insurance. But long story short, like, that's reality, and I was declined. So I paid the first month $1,100, but then when I used the compound, the same exact effect. So you know what? Why I'm gonna do this? And that's what I'm dealing heavily with, and I do my due diligence. I don't use pharmacies that they're not FDA approved. I use the pharmacies I'm using on myself, and with all the thousands of patients we're dealing with, the compound just work fine. It's the same active ingredient, like using Tylenol or using acetaminophen. It's the
Yeah.
same medication.
Yeah, so they would pay cash to you, but then it's up to the individual. They might get reimbursement for their insurance, or the employer, they might not, but there's a possibility they could there with
They can
that.
try, yeah.
Yeah.
It's called out of network receipt or medical treatment out of network. So it's up to them. But most of the time, when you are doing the compound, they don't just because it's on the lower price side. For the other consultations and everything, they may get reimbursed. But yeah, that's a possibility. And by the way, the numbers I'm giving you, 179 and 299, it includes the shipment, the medication, and the doctor consultation. We have in this concierge kind of medical treatment. The reason for that is I know a lot of companies online. They're kind of, they take some intake, they see the patient once, and they give them the medication, and those medications are, not candy. They need close follow-up. They need, because sometimes uh, escalating dose is not the right thing for the patient. Maybe they're good with the lowest dose. Eventually, the target is to lose weight. If it's working, just keep it. So we wanted to keep that touch, even with everything, try to decrease the possible margin of benefit to make it available to the most patients. And so far, we're very happy with our results.
Yeah, no, that's great. Well, maybe tell our audience again the name of your website and how they can access it, and also how they can follow you on social media and reach out to follow
Yeah,
your work.
absolutely. Absolutely. So it's tenuous.com, tenuiss.com. You can book a free consultation online. We'll be happy to see you within 24 hours. We have a team of dedicated doctors that they will see you. Uh, we don't have MPs or PAs. With all the respect, that's how we operate. Doctors will give you the best treatment, the best options. Even if you don't want to be a member with us, we'll be happy to help you for free. No hidden cost, nothings. Tenuiss.com, Tenuiss. And you can book your free consultation, and you can follow our page on Instagram and Facebook. I'm Dr. Amer Sayed. My co-founder and colleague, Dr. Muhammad Abdullah, is also will be available for you. We started this company like 6 months ago, and we're helping a lot of patients, and we'll be happy to help you as well.
Well, this has been great. And before we leave, I wanted to compliment you. I meant to say something earlier, but compliment you on your choice of clothes. I think we go to the same tailor for our clothes.
I was about to come without the white coat, but my wife said, just put the white coat, look more professional. I was like, you know what? If I don't listen to you, it's always a problem. I'm going to listen to you this time. And yeah, we're matching.
That's great. Well, thanks so much, Amir, for joining us today and sharing your knowledge about these important peptides and the possibilities for really helping people with obesity and the other metabolic diseases. So thanks for joining us.
Absolutely, Dr. Lufkin. Thank you so much. And I just want to say, I reached my target weight as of 2 days ago. I went from 240 to 200. I'm training now for triathlon. I'm going to do it next month. And really, I'm very happy with that. I never been, like kind of marathons or triathlon person, but now I'm feeling so good in my movement. I'm almost doing 5Ks every other day as time allow and all those things. So I highly encourage people. You're gonna change your life. You're gonna transform your life with weight loss. And tenuous.com is always here for you. And I really appreciate what you do, Dr. Lufkin. I'm a big fan.
Well, thanks. And I can't think of a better testimonial with your triathlon and your weight loss. Congratulations on your success. And again, thanks for what you're doing.
Appreciate it. Welcome.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician-patient or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
No, that's good. That's for you to say. I think that's very good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes.
All right.
You need to save the recording.
All right.